When people think about managing diabetes, they usually focus on cutting carbs, taking medications, and tracking blood sugar. And while those things are important, there is something just as critical that most diabetics completely overlook, which is nutrients. The right vitamins and minerals can make diabetes management easier by improving insulin function, reducing complications, and keeping the body strong. But here is the problem. Most diabetics are deficient in key vitamins without even realizing it. These deficiencies can make a person feel constantly tired, weaken the nerves, and even lead to serious health problems over time. The good news is that fixing these deficiencies can be a major turning point for energy levels, blood sugar control, and overall health. So today, we are breaking down the top 5 essential vitamins that every diabetic needs. And by the end of this video, you will also know exactly which foods to eat and what supplements to take so that you never have to worry about these deficiencies again. Let's get started. 1. Vitamin D. If you have diabetes, vitamin D is more important than you might think. It is not just about strong bones or a good immune system. This vitamin plays a critical role in insulin function, reducing inflammation, protecting nerves, and keeping vital organs healthy. The issue is that diabetics are naturally more prone to vitamin D deficiency. This happens because insulin resistance and chronic inflammation interfere with how the body processes vitamin D. High blood sugar and frequent urination also lead to increased vitamin D loss, flushing it out before the body can fully absorb and use it. Another major factor is reduced sun exposure. Many diabetics do not spend enough time outdoors, and since sunlight is the main way the body produces vitamin D, this leads to lower levels. The problem worsens with age because the pancreas and liver become less efficient at activating vitamin D, meaning even if some is consumed, the body is not using it properly. A vitamin D deficiency can be confirmed through a simple blood test measuring vitamin D levels. But beyond a test, the body gives clear warning signs. Constant fatigue, muscle weakness, bone pain, slow wound healing, numbness, frequent infections, and brain fog are all common indicators. Some people may also experience frequent sugar cravings, mood swings, or unexplained inflammation, all of which could be linked to low vitamin D levels. When vitamin D drops too low, every major system in the body is affected. Fertility issues become more common in both men and women. In men, low vitamin D can lead to reduced testosterone and lower sperm quality. In women, it disrupts ovulation and hormone balance, making conception more difficult. It can also lower energy levels and reduce libido. The nervous system also suffers because vitamin D is essential for nerve repair and protection. Low levels can lead to worsening neuropathy, increased tingling sensations, and slower reflexes. The kidneys are also impacted since vitamin D is necessary for calcium balance, and without it, the risk of kidney stones and chronic kidney disease increases. Eye health can also decline, as low vitamin D levels contribute to retinopathy by allowing excess inflammation and oxidative stress in the small blood vessels of the retina, leading to progressive vision loss. The heart and blood vessels are not spared either. Low vitamin D levels are directly linked to high blood pressure, artery stiffness, and plaque buildup, which can increase the risk of heart attacks and strokes. On a cellular level, vitamin D acts as a key player in insulin sensitivity. It binds to vitamin D receptors in the pancreas, helping beta cells produce and release insulin more efficiently. It also plays a role in reducing chronic inflammation by lowering pro-inflammatory substances that are commonly elevated in diabetics. Another critical function of vitamin D is controlling calcium transport inside cells, which is essential for nerve signaling, muscle contractions, and overall blood sugar regulation. Getting enough vitamin D naturally depends largely on food choices. Cod liver oil is one of the most powerful sources, with just 1 tablespoon providing more than 3 times the daily requirement. Wild-caught salmon in a standard serving provides over 100%, while sardines canned with bones offer slightly over the full daily requirement. Egg yolks from 2 large eggs provide about 20%, and mushrooms that have been exposed to sunlight contain around 40%, but only if they have been grown under ultraviolet light. For those who enjoy gourmet meals, some of the best high vitamin D dishes include Japanese miso glazed salmon, which delivers nearly 1.5 times the daily requirement in just 1 serving. Norwegian pan-seared cod liver with garlic butter is an even better option, providing about 3 times the daily need. Another option is black truffle scrambled eggs with shiitake mushrooms, which offer a moderate but valuable amount of vitamin D. If food alone is not enough, supplements can help, but not all vitamin D supplements are equal. Nordic Naturals Vitamin D3, ranging from 1000 to 5000 IU per soft gel, is one of the purest and most bioavailable options. Another good choice is Thorne Research Vitamin D with K2, which combines vitamin D with vitamin K2, an important nutrient that helps the body absorb calcium properly and prevents it from building up in the arteries. Certain foods can also make vitamin D deficiency worse by interfering with its absorption. Processed vegetable oils, such as soybean and sunflower oil, increase inflammation, making it harder for the body to use vitamin D efficiently. Sugary foods and refined carbohydrates deplete magnesium, and since magnesium is essential for activating vitamin D, this makes deficiency worse. Excess alcohol can also be problematic because it affects liver function, which is where vitamin D is converted into its active form. Some whole grains, such as brown rice and whole wheat, contain compounds that can bind to minerals and reduce vitamin D absorption. Fixing a vitamin D deficiency is not just about taking a supplement. It requires getting enough sunlight, eating the right foods, and ensuring that the body can properly absorb and use the vitamin. If this information has been helpful so far, let us know in the comments. Now, let's move on to the second vitamin on this list. 2. Vitamin B12. If you have diabetes, there is a high chance that you are deficient in vitamin B12 without even realizing it. One of the biggest reasons is metformin, the very medication commonly used to manage blood sugar. While it helps control diabetes, it also blocks the body's ability to absorb vitamin B12 from food. Over time, this leads to lower levels without noticeable symptoms at first. But that is not the only problem. High blood sugar itself damages the stomach lining, reducing the ability to absorb vitamin B12. As people age, the stomach naturally produces less acid, and since stomach acid is essential for absorbing B12, this makes the deficiency even worse. What makes B12 deficiency tricky is that the symptoms develop slowly. Many people mistake them for normal aging or diabetes complications. One of the biggest warning signs is nerve damage, which can cause tingling, numbness, or burning sensations in the hands and feet. Constant fatigue, dizziness, and shortness of breath are also common since vitamin B12 is essential for producing healthy red blood cells. Memory problems, brain fog, and trouble concentrating are additional signs. Some people even start worrying about dementia when, in reality, they may just be low on vitamin B12. This deficiency affects multiple systems in the body. For men, low B12 can reduce sperm quality and testosterone levels, leading to lower fertility and reduced libido. For women, it can interfere with ovulation and increase the risk of miscarriage. The nervous system also suffers because B12 is necessary for nerve protection and repair. Without it, nerves gradually break down, worsening neuropathy and making it harder to recover. The kidneys are also affected since low B12 levels increase homocysteine, a substance that damages kidney function and raises the risk of chronic kidney disease. Vision problems may develop because the optic nerve relies on B12 for proper function, and in extreme cases, deficiency can even cause permanent vision loss. The heart and blood vessels are not spared either. Without enough B12, homocysteine levels rise, increasing the risk of artery damage, high blood pressure, and blood clots, which can lead to heart attacks and strokes. On a cellular level, vitamin B12 is essential for energy production, DNA synthesis, and nerve repair. It also helps convert homocysteine into a more useful compound, reducing inflammation and protecting the arteries. For diabetics, vitamin B12 is especially important for repairing nerve damage, improving neuropathy, and enhancing mental clarity. Without enough, insulin resistance worsens, the body ages faster, and healing slows down. The best way to increase vitamin B12 levels is through food. Since B12 is only found in animal-based foods, plant-based sources are not reliable. Some of the richest sources include beef liver, 100 grams, provides an incredible 3,500% of the daily requirement. Clams, 100 grams, contain even more at 4,000%. Sardines, 100 grams, provide 350%. Salmon, 100 grams, offers 200%. 2 large eggs supply around 25%. For those who enjoy gourmet meals, high-end sources of vitamin B12 include French foie gras with truffle sauce, 150 grams, delivers 2,000% of daily needs. Japanese uni, sea urchin, sashimi, 100 grams, provides 3,000%. Lobster thermidor, 200 grams, contains 1,500%. But not everyone eats liver or sea urchin, which is where supplements come in. The best options are Jarrow Formula's Methyl B12, 5,000 micrograms per lozenge, which dissolves under the tongue for better absorption. Thorne Research methylcobalamin, 1,000 micrograms per capsule, which is highly bioavailable and supports nerve function and energy production. Certain foods and habits make B12 deficiency worse by blocking absorption or increasing depletion. Some of the biggest culprits include excess alcohol, which damages the stomach lining and reduces absorption. Processed grains, such as white bread and pasta, which are stripped of nutrients. Acid-reducing medications like omeprazole, which lower stomach acid, and prevent B12 absorption. Refined sugar and junk food, which increase inflammation and make it harder for the body to hold onto nutrients. If you feel fatigued, forgetful, or have tingling in your hands and feet, check your vitamin B12 levels. Do not wait for symptoms to get worse. Increasing B12 intake through diet and supplements can help improve nerve health, brain function, energy levels, and overall well-being. 3. Folate, vitamin B9. Now, many diabetics do not realize how essential folate is for overall health. Unlike some other vitamins, the body does not store folate, meaning it must be replenished daily through food or supplements. The problem is that diabetes makes it harder to absorb and use folate efficiently. High blood sugar increases inflammation and oxidative stress, which interfere with folate metabolism. On top of that, metformin, the most common diabetes medication, reduces folate absorption in the intestines. Since folate is water-soluble, frequent urination further depletes it, making it even harder to maintain healthy levels. Folate deficiency symptoms are often mistaken for normal diabetes complications. These include chronic fatigue and muscle weakness, slower wound healing and frequent infections, brain fog, forgetfulness, and difficulty concentrating, pale skin, dizziness, and shortness of breath due to anemia, which occurs when folate levels drop too low. Since folate is essential for DNA synthesis and cell repair, low levels lead to slower regeneration, increased oxidative stress, and higher inflammation, problems that diabetics already struggle with. For men, folate is important for sperm health, and low levels can lead to reduced fertility. For women, folate is crucial for hormone balance and egg quality. Deficiency increases the risk of miscarriage and pregnancy complications. Libido can also decline since folate helps regulate blood flow, which is important for sexual function. Folate is also necessary for proper nerve function. Without enough, neuropathy, brain fog, depression, and memory loss can become more severe. The kidneys and eyes are also affected, as folate plays a key role in maintaining circulation and reducing oxidative stress in these organs. The cardiovascular system is at risk as well. Low folate raises homocysteine levels, which leads to artery damage, high blood pressure, and an increased risk of heart attacks and strokes. At a cellular level, folate is responsible for DNA repair, cell division, and red blood cell production. It also regulates gene expression and inflammation, which is critical for diabetics. Folate improves insulin sensitivity and keeps blood vessels flexible, preventing circulation problems. To increase folate naturally, focus on foods rich in this vitamin, such as beef liver, 100 grams provides 140% of daily needs. Spinach, 100 grams cooked, gives 65%. Lentils, 100 grams cooked, offer 90%. Asparagus, 100 grams cooked, supplies 35%. Avocados, 1 medium, provide 25%. For those who enjoy fine dining, gourmet sources of folate include French duck liver pâté, 100 grams, contains nearly 200% of daily requirements. Italian truffle-infused risotto with asparagus and spinach, 200 grams, delivers 120%. Japanese miso marinated black cod with edamame puree, 180 grams, offers 100%. If food is not enough, supplements can help. The best options are Thorne Research 5-MTHF, 1000 micrograms per capsule, which provides highly absorbable folate. Pure Encapsulations Folate, 800 micrograms per capsule, which also contains the active form for better absorption. Certain foods and habits worsen folate deficiency, including processed grains, such as white rice and white bread, which lose folate during refining. Excess alcohol, which damages folate metabolism. Diets high in sugar, which increase oxidative stress and burn through folate faster. Medications like metformin and antacids, which block folate absorption. If you experience fatigue, nervous use, memory loss, or poor circulation, increasing folate intake through diet and supplements can protect your health in the long run. 4. Magnesium. Let's talk about magnesium, one of the most underrated minerals for diabetics. If you have diabetes, chances are you're low on magnesium and don't even know it. Why? Because high blood sugar and insulin resistance cause your body to lose magnesium through urine, depleting your levels over time. The longer you have diabetes, the worse this gets. The problem: magnesium is involved in over 300 biochemical reactions in your body, and without enough of it, your health starts to break down. It plays a major role in insulin sensitivity, blood sugar control, nerve function, and heart health. When levels drop too low, you might experience muscle cramps, fatigue, anxiety, brain fog, or irregular heartbeats, but most people don't connect these symptoms to magnesium deficiency. Here's why this is a big deal: magnesium is essential for insulin function. Without it, your cells become more insulin resistant, making it harder to regulate blood sugar. Studies show that diabetics with higher magnesium levels have better blood sugar control, lower A1C levels, and reduced risk of complications like neuropathy and heart disease. But that's not all. Magnesium is also a powerful anti-inflammatory mineral. High blood sugar causes chronic inflammation, damaging nerves, blood vessels, and organs. Magnesium helps counteract this by reducing oxidative stress, improving circulation, and protecting your heart. Now, let's go deeper. What happens when you're low on magnesium? Your heart takes a hit first. Magnesium keeps blood pressure stable, prevents artery stiffness, and reduces the risk of blood clots. Low levels increase the risk of heart attacks, strokes, and arrhythmias. Your nervous system also struggles. Without enough magnesium, you're more prone to anxiety, depression, and poor sleep. If you're dealing with insomnia or waking up feeling unrested, magnesium deficiency might be the culprit. Magnesium is also critical for muscle and bone health. If you've ever experienced muscle cramps, twitching, or weakness, your body is crying out for more magnesium. Over time, a deficiency increases the risk of osteoporosis, fractures, and joint problems. So, how do you fix this? Food first, supplements second. The best natural sources of magnesium are leafy greens, nuts, seeds, and high-quality dark chocolate. Spinach, 100 grams cooked, gives you 40% of your daily needs. Pumpkin seeds, 30 grams, provide 37%, almonds, 30 grams, give 25%, and avocado, 1 medium, packs 15%. Even dark chocolate, 85% cacao, 30 grams, delivers 20% of your daily magnesium. If you enjoy luxury foods, consider black truffle-infused almond butter, 30 grams serving, which provides 45% of your magnesium needs. Japanese matcha green tea with macadamia milk, 200 milliliters, gives 35%, and Mediterranean grilled octopus with pumpkin seed pesto, 150 grams, delivers 50%. If you're still not getting enough from food, supplements can help. Magnesium glycinate is one of the best forms for absorption and nerve support. A top choice is Thorne Research Magnesium Bisglycinate, 200 mg per capsule. Another great option is Doctor's Best Magnesium, 100 mg per tablet, which is highly bioavailable and supports heart health. Be careful with things that deplete magnesium. Sugar, processed foods, caffeine, and stress all drain magnesium levels. Alcohol and diuretics increase magnesium loss through urine. If you're taking proton pump inhibitors, PPIs, for acid reflux, they also block magnesium absorption. If you're struggling with blood sugar control, muscle cramps, fatigue, or poor sleep, check your magnesium intake. Getting enough of this powerhouse mineral can improve insulin sensitivity, protect your heart, and boost your overall well-being. Remember, if you found this helpful, like, share and write your thoughts in the comment of this video and subscribe to Health Hub. We post fresh, easy to follow, research-backed health tips every single day to empower you in managing diabetes and living better. Don't forget to turn on notifications. We're here to support your health journey, because your health is worth it. 5. Vitamin K2. Now, as you know, most people know about vitamin K, but what about vitamin K2? If you have diabetes, you need this vitamin because it plays a crucial role in protecting your arteries, bones, and pancreas. Here's why K2 is essential: it prevents calcium from building up in your arteries. Diabetics are at high risk for artery calcification, which means calcium starts depositing in your blood vessels instead of your bones. Over time, this leads to stiff arteries, high blood pressure, and an increased risk of heart attacks and strokes. K2 directs calcium into your bones and teeth, where it belongs, instead of letting it clog up your arteries. Another major benefit. Vitamin K2 supports insulin production. Your pancreas relies on K2 to function properly, and studies show that higher K2 intake is linked to better insulin sensitivity and lower diabetes risk. When K2 is low, your pancreas struggles to release insulin effectively, making blood sugar control harder. Now, let's go deeper. Low vitamin K2 levels increase the risk of osteoporosis and fractures. Without enough K2, calcium doesn't get properly deposited into your bones, leading to weaker bone density over time. If you have diabetes, you're already at higher risk for brittle bones, so keeping K2 levels high is crucial. Your heart also depends on K2. Studies show that people with higher K2 intake have significantly lower rates of heart disease because their arteries stay flexible and free from calcification. If you have high blood pressure, poor circulation, or a history of heart problems, vitamin K2 could make a huge difference. So, how do you get enough K2? Food first, supplements second. The richest sources of K2 come from fermented foods and animal products. Natto, fermented soybeans, 50 grams, is the highest source, giving you over 1000% of your daily needs. Goose liver, 100 grams provides 350%, egg yolks, too large, give 20%, and grass-fed butter, 10 grams, adds 15%. Hard cheeses like Gouda and Brie, 30 grams, contain around 30%, making them a delicious way to boost your intake. If you enjoy gourmet dining, Wagyu beef liver pate with aged Gouda, 100 grams serving, delivers 500% of your K2 needs. French-style duck confit with natto infused sauce, 150 grams, provides 800%, and Italian Parmesan crusted salmon, 200 grams, gives 300%. If food alone isn't enough, K2 supplements are a great option. Look for MK7, menaquinone 7, the most bioavailable form of K2. One of the best options is Jarrow Formula's MK7, 90 micrograms per capsule, which is highly absorbable. Another excellent choice is Thorne Research Vitamin K2, 180 micrograms per capsule, designed for optimal heart and bone health. Here's what to watch out for. Calcium supplements without K2 can be dangerous because they increase artery calcification. If you're taking calcium, make sure you're also getting enough K2 to keep it from going into your arteries. Statin medications can lower K2 levels, increasing the risk of heart problems. Processed foods, trans fats, and high sugar intake also deplete K2, making deficiency more likely. If you have diabetes and want to protect your heart, bones, and insulin function, start focusing on K2. Add more K2-rich foods to your diet, consider a high-quality supplement, and avoid things that block absorption. Your arteries, bones, and pancreas will thank you. If you found this video valuable, don't forget to hit that like button, it really helps spread this information to more people who need it. I'd love to hear from you in the comments. Let me know which of these vitamins you plan to focus on more and if you've noticed any benefits from them. And if you're committed to taking control of your diabetes and overall health, make sure to subscribe. We've got more expert-backed, life-changing tips coming your way. Thanks for watching, and I'll see you in the next one. Stay healthy and take care. Congratulations on taking another step toward better health. But wait, it doesn't stop here. Want to know which foods could shockingly lower your sugar levels? Or the secret breakfast ideas every diabetic should try? Don't miss these must-watch videos on your screen right now. They're packed with insights that could change your life. Click one and start your journey to healthier choices today.